Hello, Mrs. Safe. Please have a seat.
Thanks.
My name is Mary. How can I help you?
I'm here to get screened for cervical cancer. My sister had it done last week and said I should come in. I haven't had it done before.
Okay. Well, before we talk more about what you need, it's important that you understand that everything we talk about is confidential. It will be documented in your chart, but it won't be shared. Okay?
Okay, yeah.
Okay. It's great that you came in for the screening. Before we get to that, I'll need some information from you regarding your health history, particularly around your reproductive health. Is that okay?
Of course.
Okay. What's your age, Mrs. Safe?
I'm 38.
Very good. And at what age did you begin menstruating?
I don't remember very well, but I believe I was around 12. Yes, I was around 12.
Okay. And when was your last menstrual period?
I believe I started on October 12th. It was a Monday.
Okay, excellent. Now, Mrs. Safe, do you have any children?
Yes, I have 2 children, a boy and a girl, ages 8 and 4.
Okay. Do you plan on having any more kids?
No, my husband and I decided 2 is plenty. I had an IUD placed after my second child.
Okay, fine. Now, this is a sensitive question, but it's an important one. Please remember that this is a confidential health history. Have you ever had a sexually transmitted infection in your life?
Not that I'm aware of. My husband and I are monogamous.
Have you ever been tested for an STI?
No, I haven't.
Have you ever had any surgeries or procedures in your pelvic area? Okay. What do you already know about cervical cancer and screening for cervical cancer?
My sister told me that cervical cancer can kill you and that you have to have a pelvic exam to be tested.
Well, she's right. Cervical cancer is caused by a sexually transmitted virus called human papillomavirus. And if not found and treated, can and does kill many women every year. It's a major cause of death for women between 35 and 60 years old in developing countries. Women with many sexual partners, women with HIV, women who smoke, who started having sex early or before about the age of 20, or who have a mother or sister with cervical cancer are at a greater risk. HPV and cervical cancer can be prevented through vaccination against HPV where available, and through limiting sexual partners and using a condom. If not tested and identified, cervical cancer will lead to death. Do you have any questions on this?
No, not yet.
Okay. Well, we test for cervical cancer using visual inspection with acetic acid. And basically this means we wash your cervix with vinegar and look for abnormalities or anything unusual. Unhealthy cells will show up white with vinegar on them. If we find anything that looks abnormal, we'll treat it by killing any abnormal cells by freezing them off with a special machine. This is called cryotherapy, and it can prevent cervical cancer by killing abnormal cells or treating early stages of cancer. It is 90% effective for up to 5 years. What questions do you have about the test and possible treatment?
Does the test hurt? Or the treatment? Does the treatment hurt?
Well, the test doesn't hurt. And if you need some treatment, there is some cramping and a feeling of cold in the vagina, but it passes quickly. And it's a pain that's treated with oral pain medication. It's really not that painful. Do you have any other thoughts or concerns about the test?
No, not right now. It sounds like my risk is low.
Yes, it is, but it's better to be safe. So you are ready to have the test now? Okay, great. We'll set you up for the test in the next room. I'll be with you shortly.